I'm BC Seniors Advocate Dan Levitt. Thank you for coming today. I'd like to acknowledge we are in the territory of the Lekwungen peoples, the Songhees, and Esquimalt First Nations. I'd also like to recognize it's Seniors Week, my favorite week of the year. I know many communities have events and activities planned, and I'm looking forward to enjoying more later after today, and I've already enjoyed some celebrations earlier this week. I was honored to be appointed BC's second Seniors Advocate earlier this year. I recognize the massive responsibility that comes with advocating for seniors. One of my first priorities was to meet with seniors throughout British Columbia. I wanted to hear directly from them about their experiences. I asked them to share with me what's working well, the challenges they're facing, and their suggestions for change. The report being released today details what I learned from those meetings and what we hear from seniors who contact our office on a regular basis. I traveled to 24 communities in April, met with hundreds of seniors, and heard from nearly 60 organizations providing services for seniors. I visited rural and urban communities, large and small, throughout our province. I met with people who have dedicated their professional lives to helping seniors access programs and services in their communities. I also met with seniors who volunteer helping other seniors. Their commitment means many older people in their towns and cities can access meal programs, can travel to appointments, or buy groceries. And they visit with seniors who live alone to help prevent loneliness, isolation, and social exclusion. Their commitment to their communities and to others is quite amazing. Seniors are the backbone of volunteerism in British Columbia. Without their dedication, many people would go without. But while I was encouraged by the amount of caring and compassion I saw, it is clear many people are struggling. I heard of the difficulties seniors face caring for a loved one as they themselves are growing older. I heard about couples being separated. One woman told me she travels once a week over half an hour on a mountain road to visit her husband in long-term care because a bed wasn't available in her town. People express frustration with wanting to remain at home, but they can't find the help to manage some of the tasks of daily living. For many, there's no service available in their community. The wait lists are too long, or the support is unreliable due to the lack of staff and volunteers. I heard of seniors paying thousands of dollars in travel expenses to access medical care here in British Columbia. One man who plans on working into his 70s told me he wasn't sure how he would manage because he will lose his employee extended health benefits just because he's turning 65. Others told me of the enormous change in a senior's life when they can no longer drive. In many communities, there are no affordable or viable transportation options for seniors. As a result, they feel lonely, isolated, and excluded. Overwhelmingly, though, the number one issue I heard when talking with people in every community I visited is affordability. Many low-income seniors are having trouble paying rent, buying groceries, covering mobility aids, and other costs that aren't paid for through our publicly insured healthcare system. 1 in 4 seniors in BC live in incomes of less than $23,000 a year, which is below the poverty line. Many seniors on fixed incomes, and they don't have options to earn more money to cover increasing costs. I was told more and more seniors are using food banks and accessing community meal services and are at risk of homelessness. One benefit that provides a little relief is the BC Senior Supplement. Low-income eligible seniors may qualify for this monthly income top-up. The maximum monthly benefit for a single senior is up to $99.30. That's 70% of recipients do not receive the maximum. The supplement is also not indexed to inflation, and it's the fourth lowest benefit of its kind in Canada. Low-income seniors who rent may also qualify for the Shelter Aid for Elderly Renters, or SAFER program. Unfortunately, the recent changes announced don't go far enough. It's meant for low-income seniors to pay no more than 30% of their income on rent. The SAFER benefit is also not tied to allowable rent increases nor to inflation. When the rents go up, there is no corresponding SAFER benefit increase for recipients. When a senior's federal pension incomes goes up because it's tied to inflation, the SAFER subsidies clawed back, leaving them no further ahead. Let me break this down a bit. For the average SAFER recipient, the average monthly rent is $1,737. The average rent is $1,116 because they have been living in their apartment for a while. The SAFER subsidy increase taking effect in August, in this example, the increase is $115 per month. This change means they will be paying 43% of their income on rent. The extra $115 does not make a substantial difference for the lowest income seniors who rent. 43% of your income on rent is well above the program's designated threshold of 30%. Now, the story is even worse if a senior has to enter in today's rental market or move from the current apartment where they've been living for years and likely enjoying a low renter price. The CMHC market rent in Vancouver for a one-bedroom last year was just under $1,700. I think it's safe to say that if you're trying to find a place to live and your rent is that much, it'd be very difficult to find that in today's market. This means even for the new SAFER changes, the senior will be paying 76% of their income on rent if they had to find an apartment in today's market. This puts them at risk of homelessness. Improving SAFER and increasing the BC Senior Supplement are two changes the provincial government could make today that would substantially improve the quality of life for seniors in BC. Seniors are the fastest growing population group in British Columbia. Currently, 1 in 5 British Columbians is 65. By 2036, just in 12 years from now, 1 in 4, 25% of BC will be a senior. Then, the oldest baby boomers will be 90 years of age. We're generally healthier and living longer. More people will be over 65 in the next decade, more than any other time in our history. That's good news. But the question is, are we prepared? The short answer is no. At age 85, seniors begin to rely much more heavily on our publicly funded healthcare system. I heard from seniors and service providers, assisted living and long-term care are not available in the right place at the right time. There are demand and supply issues now and will only grow exponentially in the coming decade. Seniors say there are often no options for long-term care or assisted living in their home communities. Due to these challenges, my office will be undertaking a systemic review of access and wait lists for long-term care and assisted living. There are also very few affordable senior housing units available in some communities. Even if a senior wanted to sell their home, there may be nowhere locally for them to move to. We also know that despite a major increase in the seniors' population, which is fast approaching, seniors feel invisible and forgotten. Services are fractured, not coordinated, and seniors don't know where to go for support when it's needed. Several ministries in BC have responsibilities for supports and programs for older people. I'm urging the provincial government to develop a cross-governmental plan in order to improve services and prioritize the needs of seniors. 95% of seniors live in their own home. The vast majority of seniors want to live independently in their own home for as long as possible. But seniors told me they don't have what they need to age in place. Home support is not providing enough care for seniors to live well at home. A senior with an annual income of $30,000 a year must pay $9,000 a year for 1 hour daily visit of home support. For every $3 they have, they're spending one of those dollars for home support. Low-income seniors receive services for no cost, but a senior with an income above $30,000 must pay and pay a lot. The fees are cost prohibitive for many who simply can't afford it. It's important to point out that the majority of provinces in Canada do not charge for home support services, and this includes Alberta and Ontario. BC does charge, and is one of the most expensive in Canada. Our office has repeatedly urged government to lower the cost and increase availability of home support services. Despite some investments, the fees remain high. Many seniors aren't able to access subsidized home support services, or they don't get enough care. Home support also does not provide non-healthcare related tasks that seniors cannot manage on their own. However, the Better at Home program does provide services like housekeeping, grocery shopping, transportation, and snow shoveling for low or no cost. Seniors appreciate this program very much, but they need more of it. The program must be bolstered to meet the increasing demand now, and even more in the years to come as our population of seniors grows. To remain at home, many seniors also need community support services. Seniors and service providers told me more funding is required for senior centers and those community centers to provide services such as meals programs, digital literacy education, social and recreational activities, and local service navigation. Many centers don't have a single dedicated source of funding, but provide vital support for many older people. I also heard from seniors who want more preventative health care. Specifically, they mentioned more vaccination coverage, the shingles vaccine in particular. 1 in 3 Canadians will get shingles, and seniors are more at risk. The cost of the vaccine is $300. I think we all can agree that the cost of treating someone who gets shingles is more than $300. Therefore, I want the government to make vaccines available specifically for shingles for free for seniors at no cost. On a personal note, I want to thank everyone who took the time to meet and share their experiences. I heard many personal and difficult stories from seniors in communities large and small. Your input was invaluable and very much appreciated. And the information you provided has contributed to this report. My full report outlines the many challenges for government that, if addressed, would improve the quality of life for seniors in our province. But these are the top actions government must take now. Firstly, redesign the SAFER program to provide immediate financial relief for low-income senior renters. Number 2, increase the amount of the BC Senior Supplement and index it to inflation. Number 3, eliminate the daily charge for home support. Number 4, implement a publicly funded shingles vaccine program. And 5, develop and implement a cross-ministry strategy and action plan for seniors. To conclude, it's Seniors Week, and I wanted to release this report this week to amplify the voices of older people in BC. I'm passionate about improving the lives of seniors and eager to take on this challenge as BC's new seniors advocate. It's clear we have lots to do. It's in all of our interests to make the needs of seniors a priority. If we live long enough, we will all become seniors one day. Thank you for coming, and I'd be happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up. We'll start in the room.
Richard Zussman, Global News. These are some pretty big asks you have here. So is there a timeline that you set here by how quickly you'd like to see government respond to some of these things?
Well, I'd like to see them respond immediately. It is a big ask. I think seniors are important. They deserve these recommendations. That's why we're urging the government to make these now. There are other issues we heard about that will be systemic reviews that will take much longer. Some of these are funding issues. If you fund the shingles vaccine, you can do that tomorrow. Same thing with home support. We could be funding that and eliminating the user fee. So these are things we can do immediately, including the SAFER grant, improving that.
two things are true. We're in an election year, and seniors vote. And do you think the political parties need to build some things around for seniors, considering they are largely a demographic that steps in? And could these be things that political parties check off a platform list?
Seniors have built our province, and I think they deserve to have the social supports they need so they can age in their communities where they live. The things we identified in this report, the things we heard from seniors are the things I believe we need to do. And we want to see seniors age in their communities where they live, where they don't have to leave their community because there's not long-term care in their home, and they can't age in their house because they can't get home support or because they can't renovate their home. So we want to see those things done as soon as possible, and we want to see our communities be more age-friendly, more dementia-friendly, so we all can be proud of having inclusion of seniors in our communities. I think diversity is really important for British Columbians, and seniors being part of that and being part of our communities and staying there is very important to all of us.
Hi, I just Rob Buffin with CTV. My first question kind of double-barreled. I was at a food shelter, Mustard Seed, last week, and there was a senior there who said she's been going there regularly because the cost of housing plus food is just too much, so she has to rely on this. I gather this is becoming increasingly common. I'm hoping to get your comments on that, and also specifically in relation to the immediate relief for low-income senior renters. How much money, like quantifying that, what do you want to see in that regard?
So on the SAFER grant, in particular for renters, the program was designed to be 30% of their income. Right now, with the changes they've announced, in August will come into effect, it's 43%. So 43% definitely isn't 30%. So we want to see that being bolstered, so it's only 30% of their income. That would make a big difference, mainly because of the severity of the rental problem we're seeing, where how expensive rents are in Vancouver. $1,700 is the average if you can find that in Vancouver. And you think about how much money a low-income senior will have. They don't have much more than $2,000 a month. So you think about how do you survive on that? That leads to homelessness. So that's critically important. In terms of your point about the food banks and the lineups, we're seeing more people with gray hair in those lineups than ever before. I believe 8% of seniors or 8% of the people in the food banks are seniors, I believe. And our challenge is that they're the fastest demographic at food banks. We're seeing more and more seniors having to rely on food banks just to live. And that's something we should be very mindful of and be doing something to improve on.
And I guess for a second question, I wanted to get your further thoughts on just the healthcare system generally. I think you had given interviews several weeks ago when there was a senior in the Victoria area who spent multiple days in the hallway at Victoria General Hospital. And obviously it's not a good situation for anyone to be in the hallways, but we're seeing fragile people days at a time in the hallway. Do we need to do something specifically better in our healthcare system to address that?
Well, I think what we could do immediately is look at preventive health care. I think that's why the vaccines, that suite of vaccines that seniors could access, are critically important. The shingles vaccine is one of those things. I think when you start looking at how critically devastating it is for somebody who falls as a senior, and look what happens next. Preventative measures there are very important. So putting more money up front, putting more services at home in the community so seniors don't have to rely on the healthcare system, in particular the acute care system. I think within hospitals we can certainly make them more age-friendly, more dementia-friendly, and we can have areas that are specifically designed and staffed for seniors. We've seen that in some jurisdictions where they have a geriatric healthcare system within a hospital. So I would love to see more of that coming, and we'll be working hard to make sure that the healthcare system is age-friendly for everyone, especially for seniors.
Hi, Yvonne Raymond with CTV Vancouver Island. These are action points to address current problems. Is there anything that you heard from your tour with seniors that would help prevent these issues from becoming a problem in the first place? Anything kind of in their, just anything to kind of prevent these issues from even occurring?
So what can seniors do to prevent finding themselves in this situation?
Or more importantly, are there things that we can be doing to support seniors to land in this situation ahead of time?
So I think our biggest challenge right now is that we have seniors. Half of the seniors in British Columbia today are making less money than somebody working full-time on minimum wage. And that's one point when you think about if you're trying to find a place to live, you're competing, especially in the renter market, you're competing with people who are working full-time making more money than you are. So it's a very difficult situation for renters. When you think about the future, the demand is going to be there for more long-term care and assisted living. That's why we're going to be looking at that as a systemic review and making sure that we know what kind of numbers we need in terms of new builds, where they're located, so that seniors don't have to leave their community in order to find long-term care and the supports they need. We'd also like to see things like home support being more available and at no cost to seniors.
And as a follow-up, Vancouver Island obviously has some of the oldest populations in the entire country. Is there anything you heard in terms of issues that are maybe unique to the island or more kind of pertinent from some of the other regions of BC?
So I think when you think of Vancouver Island, you think of Port Hardy, for example. I had the chance to drive up there. It's a 2.5-hour drive, mostly forest between Campbell River and Port Hardy. And what struck me the most was someone from Port Hardy who has to travel to Mid-Island or Victoria or even the mainland to get health care. Transportation is a huge issue. So you start looking at where seniors are living. There are more seniors on Vancouver Island. Some communities have more than half of the population of seniors, and certainly the issues here are critical. And I think positioning services where people live is very, very needed. We met with some seniors. One particular woman, her husband lives half an hour away, and because he needs long-term care. So we want to see much more infrastructure being built where seniors live, and proportionately because of the population, we need more of it on Vancouver Island.
We'll go to the phone now. We have Alec Lazenby from BC Today.
Hi there. I just wanted to ask, your predecessor, Isabel McKenzie, talked repeatedly about the issue with for-profit care homes providing way less hours of care despite raking in enormous profits than nonprofit care homes. Just wondering, I know you're talking a lot about having seniors age in place, but what did you find when you were touring the province about the discrepancy between, the public and private long-term care home?
Well, the issue I think that my predecessor looked at, and certainly the Billions of Reasons to Care, the two reports that were issued, looked at really accountability of the funding. Is the funding being spent where it should be spent? When I've toured BC and for the 30 years working in long-term care, generally the care homes, the colleagues I worked with are doing a phenomenal job providing great care for seniors. And those situations where there are some concerns, there are systems in place to address those challenges, if it's quality care or otherwise. And I think the long-term care industry has come a long way. We still have room for improvement. I think what we need to focus on right now is that there is not enough long-term care and assisted living available for seniors. There's a demand and supply issue, and with the fact that currently the oldest baby boomer today is 78 years of age. In 7 years, they'll be 85, and 85 is when we see more than a third of seniors require long-term care, assisted living, or home care. So we got to really invest in the infrastructure. So when we have really 7 years of a timeline to get it right.
Did you have a follow-up?
Yes, I do. I just wanted to ask, back to the SAFER program, do you have a cost estimate for how much more it would cost the province to bring that down so that seniors are only having to pay 30% of their rent for housing? Do you have an idea of a ballpark of how much that might cost?
No, I don't have that number, but I can get you that number. But I can tell you that a senior who is on limited income and who's spending 43% of their income on rent, We're very concerned about that. The program's supposed to be 30%, so it's missing the mark. Really, that's our key point that we're trying to make there. And also, if you're trying to enter the current rental market now and you're a senior on fixed income, or if you get rent evicted and have to move somewhere, you're going to be paying a lot more, and 76% of income is just not affordable for rent. That's where we see cases of homelessness. And if you just think about how much money they have left over to pay for the cost of daily living, there's just not enough money for them to get by.
Next, we'll go to Mary Brooke from Island Social Trends.
Hi, Mr. Levitt. Thanks for this report today. It looks like you're taking things in a more holistic direction. The SAFER program just got adjusted, and it sounded like the housing minister, felt that was more than enough. So how can you be more convincing to push for more so soon?
Well, Mary, thanks for the question. We think that the improvements were helpful, but didn't go far enough. There were 4,800 people added to the program, just shy of 5,000 people added to the program. Again, not enough people. We think the rent ceiling should be higher. We think the amount of the subsidy should be increased. Some people are getting a small subsidy, so we want to see that being increased. And as I mentioned, we really want to see the program hit its mandate of 30% of their income on rent. 43% or higher is just too much. So we want to see it continuing to improve.
Did you have a follow-up?
Yes, thank you. For home care to be at no cost, as you say is the case in Ontario and Alberta, what is the ministry's response to you that they can't do this? Like, it sounds like a switch could be flipped quickly to do that. I realize there's a budget aspect to it, but what kind of argument are you getting back about not doing that?
Well, Mary, I think your question says it all. It's a budget question, and it's a priority. We think this is what we heard from seniors. Seniors told us and told me that, and they asked me to amplify their voice to make sure that we all know and the government knows that their needs should be a priority. And when you have seniors who are spending $9,000 a year for home support, that's $1 out of every $3 they have for if somebody making $30,000 or more. And it's a cliff, if you will. They're under $30,000, it's covered, but over $30,000 of income, it's not. So, $1 in $3 spent on home support, it's not affordable. There's scenarios where some seniors are moving to long-term care prematurely because it's cheaper to live in long-term care than to receive home support at home. So our job in this office is to amplify the voice of seniors, to present those issues in front of government. And I think this is a priority for government, and it's something I believe they want to do. And I'm optimistic that we'll see this hopefully in the next budget. I'm optimistic about it. That's why we put it in this report, to remind the public that it's something that should be done.
Thanks, everyone. That concludes today's event.